My first experience with schizophrenia was with a 17-year-old girl that we will call Jamera. Jamera was at a residential treatment facility that I was working at, and she had a schizophrenic break right before she was about to be discharged. She began speaking to a demon named Sheik, and she became extremely violent to the staff that had been taking care of her for quite some time, that she loved very much. 1% of the population is affected by schizophrenia, which correlates to more than 2 million people in the United States. After my experience with Jamera and working with her and her treatment team, I had great interest in schizophrenia, and I have done extensive research on the subject and those diagnosed with it. Today, we will discuss the history and background of schizophrenia. I'll talk specifically about the origins of schizophrenia and its symptoms and diagnosis and the different types of schizophrenia and how it is treated. What does it mean to be schizophrenic? Schizophrenic is a chronic, severe, and debilitating mental illness. It is considered one of the psychotic mental disorders and is characterized by thought, mental, and social problems. Schizophrenia has only been recognized since 1911. It was deemed a separate mental illness by Emil Kraepelin. There are now 100 to 200,000 new people diagnosed with schizophrenia every year in the United States. Prior to this, the schizophrenic patients were often thought of as possessed by evil spirits or demons. Schizophrenia now makes up 50% of patients in mental hospitals. It affects men 1.5 more times than women, and the average age for diagnosis is 17 to 35. UpToDate.com, accessed on February 26, 2014, states that schizophrenia has numerous clinical manifestations, including positive and negative symptoms, mood and anxiety symptoms, and cognitive impairment. Positive symptoms of schizophrenia are an exaggeration of the normal thought process. They include hallucinations, delusions, and disorganization. Negative symptoms are the absence of normal process, such as flat affect or lack of energy. Mood and anxiety symptoms are common in schizophrenia. Depression is also very common. The area of cognition most affected by schizophrenia are attention, working memory, reasonable and executive functioning, verbal comprehension, and social cognition. This population finds it difficult to process information and to remember simple tasks. According to the book DSM-5, there must be 2 or more of the characteristic symptoms present for a specific portion of time during a 1-month period. These symptoms are delusions, hallucinations, disorganized speech, grossly disorganized or catatonic behavior, or negative symptoms. Now that we know some of the history of schizophrenia, its symptoms, and diagnosis, I would like to discuss the different types of schizophrenia. In his book, Me, Myself, and Them, a first-hand account of one young person's experience with schizophrenia, Kurt Snyder explains the different forms schizophrenia can take. There are several types of schizophrenia. Each of these types are dependent on the symptoms a person has at the time of assessment or diagnosis. Paranoid schizophrenia is characterized by delusions and auditory hallucinations. These people are relatively normal intellectually. Behaviors exhibited can be anger, aloofness, anxiety, and argumentativeness. Disorganized schizophrenia is characterized by speech or behavior that are disorganized or difficult to understand. They may display inappropriate emotions, and these behaviors may disrupt daily functions such as preparing meals and getting dressed. These people may be completely, catatonic schizophrenia is characterized by disturbances of movement. These people may be completely immobile for hours, or they may be moving all over the place. They may repeat everything you do senselessly, or they may not talk for hours. So how do we treat schizophrenia? Research has shown that medication and cognitive behavior therapy tend to be the most successful treatments for schizophrenia, but relapse rates can be high. The proper treatment of schizophrenia can help patients resist drug abuse and improve their functioning in society. According to the January 2013 edition of the National Collaborating Center for Mental Health, medicine plays a vital role in the treatment of schizophrenia. Mood stabilizers can be useful in treating the mood swings that can occur, and antidepressants are used for the depression that often accompanies schizophrenia. The February 1st, 2010 edition of Community Mental Health Journal states that cognitive behavior therapy, or CBT, is a reality-based intervention that focuses on helping a client understand and change patterns that tend to interfere with their inability to interact with others and otherwise function. CBT is one of the fastest growing and most effective therapies for schizophrenia, and intervention can be done individually or in group sessions. Today we talked about the history and background of schizophrenia. Specifically, we looked at the origins of schizophrenia and its symptoms and diagnosis, the different types of schizophrenia, and how schizophrenia is most commonly treated. Unfortunately, when Jamera left the treatment center that I was working at, she did have to go into a mental hospital and now makes up part of that 50% of the schizophrenic population in mental health, which has led me to want to continue my education and hopefully be a therapist for people that are suffering from schizophrenia and other mental disorders. Thank you.